Do you know that there's a disease that is often misdiagnosed that it's referred to as the missed disease by physicians? Let me tell you about endometriosis. It's a gynecological condition that occurs when endometrial tissue spreads beyond and outside the uterus, causing symptoms such as immense pain and infertility. According to the World Health Organization, it's estimated that around 10% of females of reproductive age have this disorder. That's about 190 million people. However, as common as the disease is, it's also one of the most misdiagnosed. In fact, a study consisting of endometriosis patients determined that 75.2% of them had initially been misdiagnosed, and the average time taken to get the correct diagnosis was around 10 years. Currently, laparoscopic surgery is the only available method to diagnose this condition. It is an invasive method that requires expensive tools and professionals, making it inaccessible for many females around the world. The out-of-pocket cost for a single laparoscopic surgery is around $4,900 and can lead to a plethora of side effects. Today, there is not a single widespread diagnostic method available that is affordable and quick. Introducing EndoPad, our product that aims to bridge this gap in healthcare. EndoPad is a menstrual pad that helps diagnose women with endometriosis non-invasively. Blood, serum, and other bodily fluids are often used for diagnostics, but our company has decided to utilize menstrual blood, a new diagnostic biofluid that's often overlooked. Recently, scientists identified proteins CXCL5 and IL-1RN, which were drastically increased in the menstrual blood of patients with endometriosis. This indicated that these proteins could be used as potential biomarkers. Inspired with the study, we decided to develop a menstrual pad that can detect a panel of these protein biomarkers. So, how does it work? Our product is a menstrual pad that comes with a lateral flow assay attached to it. Our product works similarly as a pregnancy test. The pad contains a small oval inlet that collects menstrual blood. Attached to this oval will be our lateral flow assay hidden inside the pad. The lateral flow assay will target the proteins CXCL5 and IL-1RN. The menstrual blood will flow through the assay and bind to the gold conjugated antibodies on the conjugate pad. As they travel down the test, the target will bind to the capture antibody on the test line, which will cause color to be seen, indicating presence of the protein. The more protein concentration present, the darker the test color of the stripe. After the patient is done using the menstrual pad, they can pull the assay strip by pulling the tab at the top and accessing the results. In a medical setting, this can help a doctor diagnose the disorder much faster and much more efficiently. And the best part is, EndoPad uses already existing technology. Here's a look at the current options in the endometriosis diagnosis industry. As you can see, human bias and error as well as low accessibility makes laparoscopic surgery highly unfavorable. On the other hand, EndoPad is a convenient method that doesn't require much expensive material. Not to mention, EndoPad has the option to test in the comfort of your own home. My Blue Ocean solution eliminates human bias, reduces the cost of getting a diagnosis and the time to receive a diagnosis, raises accessibility to more women around the world, and creates a unique, easy, and non-invasive diagnosis method that hasn't even been explored yet. The market value for endometriosis diagnosis is reported to be around $1.11 billion in 2021. The current market of endometriosis diagnosis is focused in a gynecology office and is based on an invasive procedure. The first market that we hope to enter are patients actively looking for a diagnosis in the gynecology office. Next, we hope to widen accessibility by implementing our product in family physician offices so people can use our product during general checkups. This will capture our non-customer market. Lastly, we hope to widen the accessibility of our product by introducing it to pharmacy stores to capture the market of people who aren't actively looking for a diagnosis. The starting price for a single EndoPad is around $100, which is much cheaper than the out-of-pocket cost of $4,900 for laparoscopic surgery. In order to gather funding for our company, we hope to partner with health corporations and pharmacies such as Walgreens and the Johnson & Johnson Company. Our company is tapping into a diagnostic method that has been largely unexplored by other diagnostic companies: menstrual blood. Menstrual blood can be utilized to detect other diseases in women too, such as cancers. We hope to expand our company in the future by creating other menstrual pads that further utilize menstrual blood to detect a wide range of diseases. Thank you for listening about EndoPad.